Same time, South African men are being urged to register for the COVID-19 vaccine. The Health Department recently flagged concerns about vaccination rates among men in the over 50 category. So far, the government has managed to roll out more than 8 million doses and says it's got 10 million more in storage. Dr. Nicholas Crisp is Deputy Director General in the Department of Health and joins us now to talk more about men and vaccination for COVID. Doctor, afternoon. Thankful for your time on this Sunday afternoon. How do vaccination rates compare between men in the over 50 category and women?
Good afternoon to the viewers. I really want to appeal that now is not the time to let the ladies down. We are only 1/3 of vaccinations are amongst men and 2/3 amongst women so far. And of course, it is older people who are the highest at risk for severe infection and for hospitalization, and men spared from that either. So we really need to appeal to men to come forward. We know that men often don't come forward for public health programs, but now is not the time to hang back. We need to really encourage all men to come forward for vaccination.
And doctor, just in your sense, is it that, as you were saying, men generally don't have high numbers of participation in public health programs? Is that what we're seeing here, or are they more vaccine hesitant?
So we expect to see fewer men in public health programs generally. We see it across the board with TB, antiretroviral rollouts, other vaccination programs. Generally, men seem to hang back. They seem to think that they tolerate pain reasonably well. They hang back from engaging in public health systems. So this is not unheard of or abnormal behavior, but now is really not the time to be brave or to be hesitant at all. We're all exposed to COVID virus, and we all need to get vaccinated, and important that the men support the women and join in and show that we are interested in these vaccination programs.
And Dr. Crisp, just to let you know, please be aware, if you do hear me speak over you at some point, it's because we have a bit of an unstable internet connection, but I want us to persevere with our connection, please, if you could be so kind. And I want to ask you about whether you've seen any change then in the numbers of men coming forward, because it was about, I think, 8-9 days ago when you issued the appeal to the over 50s in particular to come forward.
Yeah, we're not seeing a particular change in the age group 50s and above or 60s and above. Now, we do know that there are fewer men over the age of 60 than there are women, but that's still not enough to account for this. We also know that we have been vaccinating, for instance, healthcare workers and education workers in the social development sector, and there are more women in those sectors, but it still doesn't account for vaccinations. And generally, we would like to encourage all people and the young people to bring their fathers and their uncles and their mothers and grandfathers and grandmothers and so forth, and join in and make sure that we get as many people vaccinated, especially older people. And
beyond a conversation such as the one you and I are having, and as you're saying, the appeal for us, perhaps younger ones, to bring in our parents for vaccination, who are our fathers in particular and grandfathers, what is the approach from the Department of Health? Because I've been seeing on social media in the last few days an SMS apparently that's encouraging men to come forward.
Well, I think there are a number of appeals that have gone out. I'm one of those old people myself who's not very capable and competent on social media, so I won't be watching it. And I think that is part of the problem with older people, is they're not very engaged with social media. They listen to the radio and listen to programs such as yours now, which is why we're grateful for the media for opportunities to talk to people of that age category and men in particular in this way.
The young'uns are saying if the older generation won't come forward and get vaccinated, let's open this up to the 18 to 34 cohort. Do you think that should happen earlier?
Well, there's still quite a lot of people in the 35 to 49 category that are queuing and are coming for vaccinations. So we need to give it a little bit of a chance. There are 12 million people in the country in those categories. And we would still like to reach a total of about another 1 million people over the age of 50, at least. So it might be a little bit too early, and the President has announced the 1st of September. So we'll see how it goes, and if we see that there's a need, we will ask our political principals if we can bring it forward a bit. But for now, it's important that we try to get to more of the older people.
Dr. Nicholas Crisp, Deputy Director General in the Health Department, good to speak to you. Thank you for your time, sir.